Question 2 on the Right Honourable Chris Hipkins.
Thank you, Mr Speaker. To the Prime Minister, does he stand by all of his government statements and actions?
The Right Honourable Prime Minister.
Thank you, Mr Speaker. And yes, and especially our action to take pressure off inflation and interest rates and support working Kiwis with the cost of living. The last few years have been incredibly tough with all the wasteful spending, the high inflation, the high interest rates, the low economic growth and the rising unemployment thanks to the last Labor government. And we are working hard to take sensible economic action, sensible spending, personal tax relief, which Labor never supported, inflation relief, interest rate relief, and I just wish the Leader of the Opposition would celebrate with us the great news for working New Zealanders today.
Supplementary, Mr Speaker. Does he stand by his statement, quote, "We've got to get the right leaders into these big agencies and big departments. They're big organisations, and when you get the right leader at the top, it makes all the difference through the organisation," end quote. If so, is he confident that the Health Commissioner he appointed is the right person at the top of the health system?
Yes and yes.
Supplementary question. Does he stand by his decision to appoint Health Commissioner Lester Levy, given that only 6 months later, a task force has reportedly been established to rewrite the turnaround plan that the Commissioner himself was appointed to come up with?
Well, I'll just say this government inherited a botched merger of the healthcare system. Health outcomes went backwards under the last government, and we are doing everything we can to turn it around. Labor voted against us putting $17 billion more, a record investment into healthcare. Are you saying you don't want us to tackle the bureaucracy so that we can get better outcomes for New Zealanders? We do.
Point of order, Mr Speaker.
A point of order. The Right Honourable Chris Hipkins.
Mr Speaker, the Prime Minister's tirade about the previous government or what the Labor Party has decided didn't actually address the question, which is whether or not he stands by the decision to appoint Lester Levy as the Commissioner, given that there is now supposedly a task force rewriting the plan that the Commissioner was appointed to come up with.
Well, thank you for informing the House of what the question was. The Prime Minister might like to respond very, very briefly to that question.
Yes.
Supplementary question. How can anyone in a leadership role in our health system have confidence that he'll back them after Shane Retty was sacked as Minister of Health, the Chief Executive of Health New Zealand went, the Director General of our health system went, the Director of Public Health went, Health New Zealand's entire health board went, and most of the remaining senior leadership in the health system have all fallen victim to his culture of deflection and blame?
Well, New Zealanders can have confidence that we actually are here to improve the healthcare system with a record investment of $17 billion, of dealing with a $2 billion fiscal cliff under Pharmac, by funding $604 million for cancer drugs, putting more money into the healthcare system than has ever happened in the history of New Zealand, being determined to fix the bureaucracy so that we improve health outcomes for New Zealanders, which went backwards under that last government.
Supplementary. Did he indicate he didn't have confidence in the Director General of Health prior to her resignation? If so, to whom did he express that lack of confidence?
No, those are issues for Health New Zealand.
How frequently has he met with...
The Right Honourable Winston Peters.
Can the Prime Minister confirm that Lester Levy has been struggling with a health framework that the last Labor government was advised not to adopt?
I can. What I can also confirm is that this is a Labor government that added thousands of extra management into the system, created massive layers between chairman and patients, and built a massive bureaucracy that failed to deliver for New Zealanders. We are spending more, we are fixing the bureaucracy, and we will get better health outcomes.
Supplementary question. How frequently has he met with...
Just everyone will be quiet while the question is asked.
How frequently has he met with or communicated with the Health Commissioner?
Probably, I can give you, I'll go back through my diary and tell you, but several times last year.
Supplementary question. Why should New Zealanders have any confidence that the latest turnaround plan for the turnaround plan will work, given so far all his government has delivered is chaos in health system leadership, a hiring freeze on frontline roles, hospital rebuild delays and cutbacks, and worsening health outcomes for New Zealand patients?
The Labor Party used to say that health was one of their core equities, and they ended up running the healthcare system into the ground. How do you botch a merger of 20 DHBs, throw a whole bunch of management on top? We're putting more money in, we're fixing the system, and we will deliver health outcomes that you failed to do in 6 years, including 3 years with an absolute majority.